Though many of us are familiar with attention deficit hyperactivity disorder, or ADHD, the journey through treatment isn't as straightforward as you may assume. Dr. Bradley Peterson, a child and adolescent psychiatrist, says the very first obstacle families face is getting an accurate diagnosis. He says that there are various other conditions that mimic similar symptoms, which can lead patients down a rabbit hole of misdiagnoses.
Maybe the most common thing is kids who are very anxious. They can be quite fidgety because they're anxious. And when you're anxious about things, like in a classroom, whether the kids are looking at you or thinking badly of you, or the teacher's thinking badly about you, that can absorb your attention and distract you from paying attention to what you need to pay attention to in class, what the teacher's saying. Most psychiatric and mental health and behavioral problems, in fact, have some impact on our ability to pay attention and stay focused. It's a pretty nonspecific symptom. And so a lot of things can look like ADHD or be confused with it.
Peterson is chief of the Division of Child and Adolescent Psychiatry and co-director of the Behavioral Health Institute at Children's Hospital, Los Angeles. There are 3 core symptoms of ADHD: hyperactivity, inattention, and impulsivity.
When people think about ADHD, their first image is that really hyperactive type. And it's usually the stereotype of a little boy who's sort of all over the place physically. What's happened over the years is it's gotten really convoluted. And when people have inattention and they're more subtle, like we often see with women and girls who have ADHD, they tend to be under sort of identified and less likely to be seen by others.
That's Dr. Andrew Kahn, Associate Director of Expertise and Strategic Design at Understood, a nonprofit for learning and thinking differences. Their new interactive tool called Through My Eyes offers users the ability to understand how neurodivergent kids think.
And as you navigate through the simulation, what you commonly see is that kids who are going through their day-to-day lives are experiencing things that we don't always see. So as the simulation goes on, it is narrated by the kids themselves. We also see through My Eyes videos where we have 9 different kids talking about their life experiences with learning and thinking differences and being neurodivergent. And I think that what you see in that situation is that the experiences as they're narrated to you by the kids themselves gives you insight into things that you wouldn't have seen otherwise.
Kahn says the program's goal is to help neurotypical people truly understand the obstacles kids with ADHD face. Many of the tasks are ones that may seem easy to others, like brushing your teeth or tying your shoes.
People get lost in the behavior that they see. So if a child has, let's say, ADHD as our example, and they're feeling really challenged by an activity, what you're likely to see is behavior. So people are going to say, oh, that child's out of their seat, or they're refusing to do a task. And in turn, people draw assumptions that that kid is lazy or defiant or unmotivated. And what they can't see is that that child is trying to filter out all of that stimulation, trying to focus their attention or navigate their energies. And those kind of misunderstandings can really lead to a lot of difficulty.
Like being reprimanded or taken out of the classroom without having their struggles ever addressed. However, the necessary support can only come after a kid has gotten an accurate diagnosis. The ideal medical professional for this is a child psychiatrist, but they can be hard to find and even harder to access. Thankfully, Peterson says teachers are a valuable resource in this journey.
Teachers can compare this child's behavior and their ability to stay focused on a task with all the other kids in the class, all the other kids that they've experienced in their teaching careers. Teachers are very, very good sources of information.
Once that diagnosis is made, the next hurdle is finding the right treatment. Every case is different, but Peterson says there are generally 2 major categories of treatment: medication and therapy.
And it can be hard to access either one or both of those. I would say that typically, in general, accessing really good psychotherapy and behavioral therapy is much harder. And even when you can access it, it's very difficult to gauge the skill set of the therapist and the care provider. Someone who calls themselves a therapist, not all of them are the same. Calling yourself a therapist doesn't make you one, and it doesn't make you a good one. So discerning who's good and really qualified is really difficult and important.
Which is where having a referral from a trusted medical professional can be extremely helpful. On the other hand, medications can be a bit easier to get right because Peterson says many pediatricians know how to prescribe the most common ones for ADHD. That's especially good news since his 2024 paper shows that drugs tend to be the best treatment for this condition.
About 80% of kids will benefit from that first trial of medicine. And it helps not only with the core symptoms of ADHD, but with other problems as well. So just global impressions of how the child's doing clinically. It helps with that pretty dramatically. It also helps with other problems like disruptive behaviors. Some kids with ADHD, because they're impulsive, they can be more aggressive than other kids. They can have trouble following rules and those sorts of things. And medicines generally help with those problems as well. So they're helpful not only for the core symptoms of ADHD, but the other kinds of problems that often come along with ADHD. So the benefits are substantial, and most kids will benefit pretty dramatically from medicine.
Peterson's systematic review, published in the journal Pediatrics, looked at how effective various interventions are on the symptoms of ADHD. And though drugs are at the top of that list, they do still have side effects that can deter some patients. They can cause appetite suppression, sleep issues, and irritability. But Peterson says it's worth taking the time to find the one that works the best for each person. There are two major classes of drugs to choose from: stimulant and non-stimulant. Peterson says stimulants are the most common and are widely helpful, but there are many reasons why parents choose to give their kids one type over the other.
I would say some families and parents in particular have a conceptual, ethical, even moral bias against stimulant medications. They're afraid that they're addictive, which when used appropriately and when prescribed by an experienced clinician, they are not addicting. But parents fear that they could be. They think that somehow those medicines will change brain structure and function when, in fact, our studies suggest that they don't. And if they do, it actually improves brain structure and function. So there are a lot of biases, especially parents will come in with, sometimes prescribers will. I would say most commonly it might be some pediatricians are reluctant to prescribe stimulants based on misinformation and some of the same biases that misinformed parents can have.
That's not to say that every patient will respond better to stimulants. It's truly a case-by-case basis. There's no right course of treatment, only that medication is an important part of that journey. Peterson's paper also revealed that supporting the parents of kids with ADHD can be very helpful. There are various types of interventions his review looked at, and many of them turned out to be worthwhile.
The intervention that most clinicians in the field believe help kids with ADHD, especially kids with ADHD who also have disruptive behaviors, trouble following rules, maybe they're aggressive, so disruptive behaviors. Most people feel that something called parent management training, that's what I refer to it as. It goes by a number of other names. But what it involves descriptively is helping parents learn the principles of behavioral management for their child to help with consequences for behaviors that you want to reinforce, like following rules and doing homework and that sort of thing, and discouraging behaviors that you would prefer not to be there, like aggression, verbal or physical aggression, and how to deal with that. So you help the parents become really the best behavioral therapist for their kid that you can possibly find, because no one knows their child better than a parent.
Since no two studies involved exactly the same parent intervention, Peterson's team lumped them into one category and ran a bunch of statistics to see if, as a group, parent support was effective for helping ADHD symptoms in kids. And regardless of which intervention was used, they found that this support can be a major benefit. What came as a big surprise for the research team was what they found when they paired multiple of these helpful interventions together.
Most people, most clinicians, and most parents believe instinctively that if medications help and psychotherapies or parent support helps, well, 1 + 1 will equal 2. And so if medications help some, but you need more help, well, let's add parent support to it, or psychotherapy for the child. And a number of studies have tested this, whether combination treatment like that is better than a single intervention alone. And what is surprising is we didn't find evidence of the case. So 1+1 here doesn't necessarily equal 2.
That doesn't mean that combining therapies will never be effective. It just means that on average, when looking at an overall group, there's no evidence that it's beneficial. Individual kids still may find a combination of therapies helpful, and Peterson says that a good clinician will be able to see which are best for their specific patient. And possibly the most important part of this journey, regardless of which type of therapy is used, is that the choices are made in partnership with the medical professionals, parents, and child.
They have to buy in, know why this is helpful, and the parents need to buy in. It all needs to be a team-based approach. Otherwise, it's not going to work. Because even if it's the best medicine and it's really helpful for this kid, if that medicine doesn't get into that kid's mouth and into the body, it's not going to be helpful.
You can find more information about Dr. Bradley Peterson, Dr. Andrew Kahn, and all of our guests on our website, radiohealthjournal.org. Our writer-producer is Kristen Farah. Our executive producer is Amira Zaveri. I'm Elizabeth Westfield.